Dear participants of the European AI Forum, our greatest challenge in Europe and all over the world this year has been and still is the COVID-19 pandemic. The COVID-19 pandemic showed us the need and value of digital health. This became evident, for example, through the implementation of registries to assess the availability of intensive care beds and telemonitoring to reduce burden on hospitals. But the pandemic has also shown us how important and necessary it is to exchange data. Just imagine what would have been possible if we had already had high quality and comparable health data accessible across the EU. What a difference would this have made to outbreak surveillance, vaccine development and the treatment of COVID-19. The Corona Warning app and tracing apps are a good example that exchange of data across borders can work and can make a difference. We have succeeded for the first time to create interoperability and make an exchange of data possible with an EU Gateways server. But health data is not only important for research and tracing apps, but also for the development of AI applications. Usually the data of one country is not enough to make the AI application robust and secure. Besides the amount of data, quality is also important. Any algorithm is just as good as the data it has been trained on. That is why we should build up training and test data sets within Europe. Currently, algorithms are mostly trained on data collected in other countries outside of Europe. Our claim should be that the companies that program for European patients work with European data. From Europe, for Europe. To make this possible, we need a common understanding on how to access, share and process health data safely and in an ethical sound manner. After all, in terms of data availability, we could say that even countries like Germany might be too big to fail, but at the same time are too small to shine. We need a European health data space. The EHDS, the European Health Data Space, is the crucial topic during our presidency of the Council of the EU. But what should this space look like? Like a house. That is the image I use. We want to build a virtual European house in which data are used safely and in compliance with data protection requirements. Just as a house has many rooms, our data house will have rooms for different purposes. For researchers, for healthcare professionals, for authorities, and above all, for patients. We want a space governed by rights and values for a fair processing of health data. Beyond that, the European Health Data Space should also become an international model for success in health research, healthcare and for greater competitiveness with regard to China and the US. To make this a reality, we together in Europe will take the first concrete steps. The Commission will propose a legislative act on European Health Data Space in 2021. A joint action with 22 member states works on options on governance, infrastructure, data quality and data solidarity and empowering citizens with regards to secondary health data use in the EU. The EU provides investments to support the European Health Data Space under the EU for Health program. And we encourage all relevant actors to develop consistent European codes of conduct for their respective processing situations in order to establish uniform interpretation and application of the GDPR in the respective areas and to facilitate GDPR-compliant cross-border data use in the Union. Let me conclude with a look into the future and a crystal ball. How will healthcare and care delivery look like in 10 years? Medical treatment becomes personal again. An emergency, the patient arrives by ambulance. She's never been there before, and yet the hospital team is well prepared for her. The rescue service's initial assessment of her is compared in the background with her electronic patient record and is available to all those treating her in real time. The necessary hospital admission has already been prepared and the relevant experts are on standby when the ambulance arrives in the emergency room. Her family doctor is telemedically connected via the trauma ward. The MRE and all other necessary examinations have been electronically scheduled. Further examinations are arranged via natural language processing. The treatment plan was tailored to the patient with a digital twin using synthetic data sets. Her room is ready. Thanks to a smart connection with the ambulance, the control center, the electronic patient record, the family doctor, the medical, nursing and administrative hospital staff can adjust to each new patient using smart technology, initiate all steps and provide optimal care, with much more time for communication and interaction with the patients. Personalized medicine in the best sense. I therefore call on Member States, I call on the Commission, and I call on stakeholders. Let's work together to develop necessary instruments and governance to set up a functioning European health data space.